We have been living in a COVID reality for the past year. The entire world has been impacted by this pandemic. However, there is one group of people who are often overlooked: students. COVID has completely transformed education and each of our relationships with it. Most students are online and working through their computers, but there's a problem with this. In 2018, it was reported that nearly 1 in 5 students were not able to finish their homework due to the digital divide.
Nearly 12 million children do not live in homes with an internet broadband connection.
And an additional challenge is some students don't have a private space at home where they can talk to teachers or talk to school counselors if they need to reach out to someone.
Dr. Jennifer Greif Green does research in education and the mental health of students at the University of Boston.
So it's important for school staff to be aware of that and to be thinking about how to connect with students if it's not clear that they have a private way to do that that feels safe to them.
Besides the issue of not having access to the technology, Dr. Green is currently doing research on how the isolation of remote learning has had a significant effect on students' mental health.
The poverty that has been rising related to the pandemic, being out of school and being socially isolated. We know that many youth are not connected to school or engaged in the school in the same way that they were before, has all taken a toll on youth mental health. And the way that what we have seen and what researchers have shown is that rates of psychiatric emergency department usage have been increasing, and rates of suicidality that are showing up in emergency rooms are increasing as well.
Students across the country are feeling the effects of the isolation.
I think for a lot of people, just not seeing or like not walking by, seeing or saying good morning to the person at the dining hall, things like that has definitely had very negative impacts on people's mental health.
Bridget Carmichael is a senior at the University of Massachusetts Amherst, majoring in law and psychology. As she deals with COVID and its effects on her school life, she also deals with a few of her own mental health issues. Carmichael deals with depression, anxiety, a mood adjustment disorder, and ADHD. This combination of issues have made adapting to this new way of education extremely difficult.
My body, like physiologically, sometimes has trouble regulating big changes or like big adjustments. And so because of COVID, I had to move in completely by myself. And like, of course, I didn't move because I'm already feeling very, very emotional, very, very upset. I wasn't really able to get everything unpacked.
To make things worse, Carmichael had an unfortunate situation. An accidental email from a professor gossiping about her further worsened her already Zoom fatigued mental health.
The night I got the email, I cried myself to sleep. Just because, not because I believed it was true, but just because I was so hurt. And then, of course, I'm already struggling to adjust with all of this change. And then now I'm having to have extra meetings, while still having to do my coursework and still unpack my room.
Carmichael, who is biracial, and members of the Black Student Union who reached out to her online, believe the message carried racially insensitive language, compounding with the issues of ableism.
A lot of like the BSU members felt that saying irresponsible was like a racial undertone, because I think words like irresponsible and lazy are microaggressions towards students with executive functioning disorders and with um like learning disabilities, because especially in the learning environment out of school like Amherst, I think it's kind of impossible to be lazy here.
Dr. Green says students of color are the ones suffering the most from all these changes.
We know that the pandemic is disproportionately affecting children of color. We know that Black and Latinx communities are experiencing worse outcomes from the pandemic. We also know that Black and Latinx children are less likely to access mental health services than their white peers.
She believes this needs to be addressed immediately.
I think it's important to consider how our service systems need to be changed and need to be re-envisioned to support all youth, and particularly youth of color, to make sure that they have access to the services that they need.
Although, Dr. Green says that mental health access has declined for all students.
We know that youth are struggling with mental health right now, and that mental health services are harder to access than before when schools are not in person.
While Dr. Green agrees that mental health has worsened for most students, she wonders if something good can come out of all this devastation.
My hope is that there will be some normalizing of mental health challenges and anxiety and stress and and trauma that have been happening related to this pandemic that will open up new conversations about mental health and also about mental health services. There continues to be a lot of stigma around mental health and mental health service access. And unfortunately, I think this event has opened up a lot of opportunities to talk about mental health. My hope is that that will lead to changes in the conversation and to more people feeling like they can reach out and get help if they need it.
Carmichael agrees and hopes once we leave COVID in the past, we will be more open to others, which will in turn benefit our mental health and the entire college experience.
Interacting more like outside of cliques. I think because like we've all been deprived of seeing anybody, everybody's excited to see anyone. Which definitely is like added to like the sense of community and belonging, especially at Amherst. So I hope that's something that isn't, the status quo doesn't become the status quo again, and that there's a lot more like interpersonal community between all groups instead of just like getting kind of separated into our small little bubbles.
For NYU Now, this is Dennis Aronov.